Hello, good morning everyone. This is Rajendran, sports physiotherapist here in Center for Sports Science at Sri Ramachandra Institute of Higher Education and Research. So I welcome you all to Introduction to Sports Physiotherapy courses. Today I'm going to talk about Introduction to Sports Physiotherapy as well as Principles of Sports Physiotherapy in Sporting Environment. Learning outcome of today's topic is, at the end of the session, you'll be able to discuss the roles and responsibilities of a sports physiotherapist. You will be able to discuss the importance of sports physiotherapy, and you will be able to describe the competencies required for a sports physiotherapist. And before we move on to the introduction, let's discuss something about World Physiotherapy. Have you all have any idea about what World Physiotherapy? Yes. It's a non-profit organization founded in the year of 1951. So the World Physiotherapy, they are the global body for 122 physiotherapist member organizations representing more than 670,000 physiotherapists across the world. And they committed to further the physiotherapy profession and improving the global health. And when you talk about their mission, so the mission is something significant. Their mission is to further the global physiotherapy profession by supporting their member organization with informations, expertise and services. And the update is the World Congress 2021 so converted into an online event. Now, let's move on to the introduction. So first, before you get into sports physiotherapy, it's a specialized one. Before that, so we should know the background to the development of sports physiotherapy. As physiotherapy is evolved, the vast knowledge, which means the wider knowledge of an individual and the skill base that we have, that lead to the development of this specialist area. So which is purely described by Donge and Gosling in the year of 1999, followed by which the sports physiotherapy as a specialization has emerged as a prominent specialization in the field of physiotherapy. Now, let's look at the definitions. What does mean by a sports physiotherapist? Here you go. The definition given by New Zealand Sports Physiotherapy Association. They define sports physiotherapist as, so the sports physiotherapist or a recognized professional who demonstrate advanced competencies where in the promotion of safe physical activity participations in terms of doing exercises or performing exercises, performing in any sporting environment, preventing injury, restore our normal functions, which means optimal functions. And then the sports physiotherapy will enhance the sports performance on an individual. Again, the same definition has also given by Bully et al. In the year of 2004. Even he described the same as what the New Zealand Physiotherapy Association has described. A sports physiotherapist is a recognized professional who demonstrate advanced competencies in the promotion of safe physical activity and adaptation of rehabilitation and training interventions for the purpose of preventing injury, restoring the optimal function and contribute to the enhancement of sports performance in athletes of all ages and abilities while ensuring a high standard of professional and ethical practice. It's the same definition given in detail by Bully et al. In the year of 2004. And we are all a physiotherapist in general, but the term called sports physiotherapist, who is a sports physiotherapist here? As described by Chartered Society of Physiotherapy in the year of 2008, who described the sports physiotherapist as those who promote health through physical activity, they called us a sports physiotherapist. Also, the individual or a physiotherapist who involved in prevention and management of injuries resulting from sports and exercises populations. For an example, in general, physiotherapy will be able to treat a person's in general conditions like stress, strain, so any kind of musculoskeletal disorders. Whereas in a team, especially, and a football player injured his knee, when he comes and approaches a sports physiotherapist, he'll be able to diagnose the conditions, he'll be able to intervene the treatment. So he's specialized in a particular professions called as sports physiotherapy. So always the person who is involved in prevention and management of injuries resulting from sports and exercise populations. Also, the sports and exercise physiotherapy in New Zealand, they also described as who provide evidence-based advice on sport and exercises. Yet that's the most important valid point. They describe as evidence-based advice. We always provide evidence-based advice, especially on sport and during exercises or during rehabilitation or even during assessment. And the Australian Physiotherapy Associations also describe the profession as a lucrative area. Now, let's talk about ethics in general and sports physiotherapy. So what do you mean by ethics in general and sports physiotherapy? Yeah, there are ethics to be followed being as a sports physiotherapy or a general physiotherapy. We have important ethics to be followed throughout our professions. So in general, so when you talk about ethics, so we have to respect the rights and dignity and laws and regulation of physical therapy, accept responsibility for a professional services, what you provide to an athlete or an individual or a patient, provide quality services. You have to have a quality in services, the way you diagnose the condition, the way you provide the treatment, and then the way you communicate with the patients or an athlete. Always there should be a quality in services. Provide accurate information to a patient or a client or an individual. The accurate information here, it describes, so we have to describe the appropriate informations. We have to deliver the appropriate informations and we have to educate the patients. So educating a patient and delivering the accurate informations make the patients to feel confidence on a sports physiotherapist. These are all the general ethics in a physiotherapy. But when you come to a specialization called a sports physiotherapy, here the sports physiotherapist should focus more on athletic health, which means they have to have a priority on athletic health. One, we never do harm. Always make sure we should not deliver appropriate treatment protocol. We should not do harm to the athlete. And we should not impose our authority on an athlete. That's the most important valid point in ethics. So also we have to have the ethics which is mentioned in general. We have to have all the ethics to be followed as being as a sports physiotherapist. Now let's move on to the roles and responsibilities. Already these factors have been described in the definitions as given by New Zealand Physiotherapy Organizations, and then Bully et al. In the year of 2004. He also described the same, but these are all the main roles and responsibilities of being a sports physiotherapist in a team. So we have to have a promotion of safe physical activity, provision of safe advice when you're dealing an athlete or when you train an athlete or when you're dealing with a sports team, and adaptations of rehabilitation and training interventions. As we discussed earlier, we have to restoring the optimal functions and enhancement of sports performance. Now let's talk about the importance of sports physiotherapy in sporting environment. So why it is important in a sporting environment, especially while you're dealing with the patient or a client, an athlete or a player? Yes, The sports physiotherapist, they help athletes recovering from injuries through exercises. Yes. We are a movement-based practitioners. We retrain the movement, we educate the movement, we teach them exercises, we help them to recover from injuries. And we also critically challenging and evaluating and practice. Yes. We have to have a critical thinking, what the patient does have, what the patients will have. So we have to have a critically challenging and evaluating a practice, and we have to develop new knowledge through a research. So we have to have updations in the field of sports physiotherapy every day. So we have to have updations on each and every aspects of injuries. So which one is showing a much significant, whether, for example, so the isometric exercises is good, or is it effective than the concentric exercises, or concentric exercises is effective than the eccentric, or eccentric training is effective than concentric or eccentric. So always we have to have evidence, we have to have a research to develop the knowledge to update our skills. And whatever the knowledge that we acquired, so we have to incorporate that and understanding of innovations into the roles that we play as advisors in sporting team. Now the competencies. Yes. So according to the according to the International Federation of Sports Physical Therapy, there are 11 competencies required for sports and exercise therapist. What they describe, the specific skills or standards, which means International Federation of Sports Physical Therapist. So they have explained the competencies. What are the competencies? So there are competencies called a manager of a patient or a client, an advisor, and a professional leader, and an innovator.